welcome to this edition of the Your Health is Important podcast, brought to you by Paging Dr. MJ, 911. I'm Dr. MJ Collier, your host, and we have our extinguished and distinguished co-host, Dr. Marlon B. Jackson. Dr. Jackson, how are you today?
Good evening, Dr. Collier. How you doing today?
I'm doing great, Dr. Jackson. So we want everybody to know that we have been in this radio game for 25 plus years. The longest running radio talk show that was previously airing on 1480 WYZE AM here in the city of Atlanta.
1991.
1991. So we have an extraordinary partnership, and we are so glad that you are participating with us. We bring to you your medical health,
your dental health,
your social health,
and anything else that's of significance, because everything will make you healthy or unhealthy.
Your political health, your financial health. We'll be bringing in experts to talk to you about a variety of different topics, but we're going to emphasize each and every broadcast your medical health and your dental health. And then we're going to talk about a topic that Dr. Jackson and I are both well versed in. We have been doing this for so long that I've got a dental education by osmosis. Sitting here listening to Dr. Jackson answer some of the most extraordinary dental questions that people have asked now. I have a dental database, nowhere near his, but I can answer a lot of the basic questions. And he has a medical acumen that is absolutely unparalleled. He's a doctor, dentist, doctor. No ifs, ands, or buts about that. So we're going to talk to you about a variety of topics. And one of our topics, the first one, I'm going to talk to you, Dr. Jackson, I'm going to throw it at you. It's sleep problems, sleep deprivation, or difficulty with a good night's sleep. Guess what? This is a problem that affects so many people. As we get older, it becomes more difficult to get a good night's sleep. Now, there are a variety of different reasons for that. Stress, anxiety, worrying about our work the next day, can't turn our brains off. These are the things that people say. I can't stop thinking at night. And so they can you give me something to shut my brain off, Dr. Collier? So I know that on occasion, as all of us do, I have problems with insomnia. I can say within the last week, I've had at least one episode, possibly two, where I didn't feel rested when I woke up, where I knew I had a conscientious awareness throughout the night that I was not asleep. I'm sitting there, laying there with my eyes closed, trying to be quiet. And, and some basic things. Let's go down the list, Dr. Jackson. One is the room too hot.
Room might be too hot. The pillows might be too old. And their mattress. Some people hold mattresses and pillows like they hold toothbrushes for 20 years.
No, far too long. And or the position of your pillow. Oftentimes, particularly when a person sleeps on their side, they will roll that pillow up, get it in a perfect position, and as soon as they move, the substance inside the pillow changes, and now their neck is either leaning this way or leaning that way. Either one is putting stress and strain on those trapezius muscles in the back of the neck, and so you can't get comfort. So you end up going from side to side in an attempt to seek comfort, and then you're not getting a good night's sleep. Also, when you're not asleep, or when you're barely asleep, your body metabolism is not cut down. So your kidneys continue to make urine, and when you lie down, that's what's called a diuresis posture. So when you're in that diuresis posture, what happens? You make urine, you got to get up and urinate. And so if you get up, you turn the lights on, you're going to tell your brain it's time to get up.
Right.
So now you're going to break the sleep cycle. And if you break the sleep cycle now, it's going to take you a full 3 hours to get back into what's called deep REM sleep, rapid eye movement sleep. This is the sleep during which you're dreaming. So if you wake up and you know that you were dreaming, you know you were in deep restorative sleep. And that's the kind that you feel rested from the next day. So basic things: is the room too hot? Two, the room should be between 68 and 72 degrees is what's been recommended by the professionals. So if you have the room cool, but you have on that thick comforter that you normally use in the middle of the winter because you didn't change your comforter
right.
in the summertime, and or normally you're in bed by yourself, and now there's two people, you have guests, so to speak, and now you got two people's body heats to disseminate, and so and if you take the entire comforter off, it's too cool. So you need a lightweight comforter during the summertime in particular, but sometimes all of the time if you sleep and you perspire when you sleep, or you get warm when you sleep, etc. Oftentimes, I know this is a big problem in the Collier household, Mrs. Collier likes to take steamy hot showers. steamy hot showers. Her skin is so red she's like a lobster when she gets out of the shower. But that also increases her basal body temperature, so she's warm when she gets in the bed. So if she gets in the bed, she's already overheated. We cover her up with a comforter, and then that's just creating an environment that's not pleasant to sleep in. So we have that issue. So the temperature, the darkness in the room. If you have a various apparatus in your room, like a computer, if you have a television that you don't have cut off, even if you have clock faces that will not dim, or if you have your cell phone and every time it downloads something, it bright lights, this is an environment that is not conducive to a good night's sleep. So unfortunately, I can't cut my cell phone off at night. Do you cut yours off, Dr. Jackson?
No, I would like to.
Yeah, but you can't do it. So all of the technology that we have, the iPads, the laptops, the desktop computers, all of the cell phones, the frequency of the light that they have is consistent with daylight. So you look at that screen, it causes your brain to release a hormone called serotonin. Serotonin tells you it's daytime, wake up. And it directly counteracts the sleep hormone, which is melatonin. So you have to avoid screen time. And unfortunately, a lot of us, at the end of the day, you've had dinner, you're chilling, you're watching television. So what do? You start doing your social media at night. You start checking your texts. You start reviewing your emails. And that screen is just too bright. So most cell phones have a setting you can't decrease the brightness of the screen, and so we highly recommend that you do that. You'll still be able to see it. HD is very good now, so you'll still be able to see your screen, but it shouldn't be as bright as it would be in the daytime. So you got a cool room. Make sure that you are not thirsty. So what I recommend is that you drink a full glass of water before you go to bed. But the last thing that you do before you take your feet off the floor is to go and empty your bladder. That way, hopefully you will be asleep, your metabolism will be shut down, and you won't make urine, so you won't have to get up in the middle of the night to urinate. Now, one of the problems that we have as a more seasoned citizens, I guess you can say a gentleman that's older than 30, then you can get some prostate issues that can cause you to have incomplete emptying of your bladder. So prostatism, or benign prostatic hypertrophy with LUTS, which means lower urinary tract symptoms, LUTS, can cause you to not have to empty your bladder, and you'll get up. It's not unusual for a man that's older than 30 to get up at least once in the middle of the night to urinate because he did not successfully empty his bladder the first time. Now, if you get up twice, you're pushing the envelope. But if you're getting up 3 times or more, you are breaking the sleep cycle. It is literally impossible for you to get a full night's sleep. So you wake up tired, so to speak. You've been in the bed. The final issue is the amount of time that you provide yourself for sleeping. Now, the universal wake-up time for most people at work is 6 a.m. That's why my first segment on Ricky Smiley Morning Show is 6:45. Give you a chance to wash your face, brush your teeth, and shave, and get into your morning routine. Be sipping that first cup of coffee so you can listen and be tuned in. So when you get up that early, but you stayed up over late night watching television, Netflix and chilling, watching late night television, talk shows, etc. Most of us are not in bed till midnight or 12:30, 1 at the latest. So you're giving yourself 5 to 6 hours each night to rest, restore, and recuperate. And that's just not sufficient. At minimum, you need to make sure that you have a guaranteed 6 to 7 hours. That means making a conscientious decision to be in bed, ready to go to sleep by 11 p.m. Now, fortunately, if you want to stay up and watch the news, every channel has a 10 o'clock news channel. So you can watch the news at 10 and be ready for bed at 11. Although if you watch the news, that might wake you up.
Well, I was going to say, Dr. Collier, some of the other things you must do to have a restful sleep is wear loose-fitting clothing. If there's no kids, none. But one other thing that I wanted to add to the mix is another dental reason that people do not get a restful sleep is if they have one of those almighty elephantine toothaches.
Oh, absolutely.
Where they wake up about 1:30, 2 o'clock, and they can't go back to sleep.
That tooth is throbbing.
And they got their head crooked to the side, and they're walking, trying to walk it off, or trying to run it off.
Walk it off, run it off, we've seen some weird things in our lifetime. We've seen people crunch up aspirin and put a crunched up aspirin on a tooth. Horrible decision to make. Although you can use some dental anesthetics like the Ambisol, topical anesthetics that will give you temporary relief. But you can't, once you've gotten through the night, please do something about it. Don't wait until the tooth is so rotten that it stops hurting. That's not a good thing. At that point, you have lost the nerve in the tooth. It cannot be salvaged. You're going to have a root canal, or you're going to have the tooth extracted. Whereas if you had gotten dental treatment when you first started to have the pain and discomfort, you might have been able to salvage that tooth. And Dr. Jackson is a strong proponent in keeping every tooth that you have.
Absolutely.
Because when you start to remove those teeth, and we're going to get into the dental aspects of it, that's a good time. We'll talk about that, what happens as you start to lose your teeth as you age. But sleeping, as far as the sleeping is concerned, you have dental issues, you have bruxism, you may grind your teeth at night, and you may grind them so hard that you wake yourself up, or that you get such significant jaw pain that that becomes a problem for you. So if you find that you have an inflammatory condition such as that, I'd recommend that you take an anti-inflammatory such as Motrin, Advil, Aleve. And if you have trouble sleeping, you can get the PM versions of those products. All of these are over the counter. The PM versions contain diphenhydramine, which is the generic name for Benadryl.
Right.
It will, it's sedating. It will make you sleepy for about 4 hours, and then it is out of your system. So it won't cause daytime sleepiness. It is a perfectly safe thing to do. You can do it as needed. You can do it every night if you feel that you need to do it as often as that. So my first line therapy would be one of the PM anti-inflammatories. Pain medications like Tylenol PM, Advil PM, Motrin PM, etc. If it has PM on it, it's got the diphenhydramine, and it's going to help you get a good night's sleep. But if that's not working, one of the things I recommend that's safe, is more natural, is melatonin.
Right.
Everybody's familiar with melatonin, Dr. Jackson.
And it works.
It works wonderfully. The problem is a lot of people don't know how to take it. The dosing range can be as little as 2 milligrams and as much as 10 milligrams. For the vast majority of people, 5 milligrams works just fine. So a lot of people think, well, if 5 milligrams work and there's a 10 milligram tablet, why don't I take 10 milligrams? Well, sometimes more is not better, because it is a hormone. It is not a sleep aid. It just potentiates sleep, and sometimes you don't need extra from that perspective, but it won't cause daytime sleepiness. It will just potentiate sleep when you're trying to sleep. One of the key things that I found melatonin works wonderfully for is if you like to travel. And I know you like to go everywhere, Dr. Jackson, but if you like to travel and you're crossing more than one timeline, then you might need melatonin to prevent jet lag. That's why your body is not acclimated to the new time zone, and you can save yourself a day of agony by taking the melatonin upon arrival, getting a good night's sleep, and then when you do wake up, first thing you do, you look up at the sun. You don't look at the sun, you look up at the sky, so that bright light will reset your brain, and it will tell your brain it's daytime, and you will find that you're now able to function as far as sleeping is concerned. So melatonin is a great way of treating sleep disorder, and again, perfectly safe. You can take it as needed. You can take it daily to help potentiate sleep. Now, but if you find that you're having to take it daily to sleep, you might want to see a sleep specialist or your primary care physician to find out if there's any other problem.
Well, I was going to also mention what could prevent you from having a restful sleep is if your mate or significant other has a snoring problem, which if you go to the dentist and we say, well, one thing that Dr. Jackson and other dentists do, we look to see how large those tonsils are and if they're enlarged. Because if they're enlarged, they kind of vibrate against the back of the palate there, giving you that sound.
That's called the tent flapping phenomenon. So you don't just snore, you go. And so this is very disturbing and very difficult to sleep next to. It amazes me that a woman as tiny as Mrs. Collier can make as much noise as she does, but she says that I snore as well. So it's a contest at night, who can go to sleep first, and whoever goes to sleep first probably will get the best night's sleep. Otherwise, it's a problem. But one of the things, your sleep posture, very important to help control that. Or, when I was growing up, you got your tonsils taken out. My tonsils were taken out when I was in kindergarten. I remember it like it was yesterday. You got your tonsils, you got ice cream afterwards, and I wore a neck collar that was full of ice. And that was it. The next day I was fine and it was good. And and so I don't have obstructive lesion that will cause me to do the tent flapping phenomena, but there are other forms of snoring that can inhibit your sleep pattern. So very good point. And one thing about a natural supplement like the melatonin is it's not going to impair you if you're having a central sleep problem. if you have an apneic problem and you take a prescription strength sleep aid, that can be very dangerous, because if you stop breathing, you might not start back breathing. So it's very important that you, again, if you find that you're having to do that regularly, you need to discuss that with your primary care physician or a sleep specialist. That is now a full specialty of medicine, sleep. And so that's what we want you to do when you're doing that, sleep specialty medicine. So a good night's sleep, melatonin, that is a great way to go. So follow me on all social media at Ask Dr. MJ. And if anybody wants to reach you, Dr. Jackson, what's your social media handle?
Atlanta's Best, DDS.
Atlanta's Best, and I can qualify that because he is my personal dentist, and he takes great care of me, and gives me a smile that won't make you gag when you look at me smiling. Okay, very good.
Well, thank you, Dr. Collier. But before we move on, let's add something else to the list that will help folks have a restful sleep.
Let's do it.
A lot of times we, especially if you're seasoned and you've been around a while, you may tend to watch the news. Well, the news has 95% negative thinking, negative speech. So if you're processing this information and you're starting to think negative along with the news, you're wondering, if you look at the news, like they say, everything, whatever bleeds leads.
That's right.
So you're looking at that, and it makes you wonder, well, how am I? Am I safe? Or do I need to buy an extra shotgun because, of all the shootings and killings going on? So people tend to worry about things. And what hormone does that make increase in your body when you're worried?
That increases the cortisol. So you get that cortisol response, which increases your blood pressure, predisposes you to diabetes. But more importantly, you get that fat disposition in the abdomen. You get that cortisol stomach. So you get that pear look where your stomach is sticking out, and as my partner, Dr. B. David Blake, says, your booty do. Your stomach sticks out further than your booty do. So you want to make sure that you don't obtain that posture. And oftentimes the stress hormone cortisol causes an increased disposition of fat in your abdomen underneath the skin. This is not the fat that you can pinch. This is not the pinch and inch fat. This is under the muscle layer, and that increases your risk for cardiovascular disease and predisposes you to a heart attack or a stroke. So very important that you minimize that. And as you state, Dr. Jackson, if it bleeds, it leads. Literally, last night I had one of my patients call me because they had heard about the one of the shootings that had happened. 3 people had gotten shot in Buckhead. No apparent logic to it, no apparent reason to it. And they were really, because they say, I just feel stressed. I'm having a stress reaction. I don't know why. Well, if you're worried about, people getting shot in Buckhead, then you need to be worried about it. So, Buckhead is a suburb in the city of Atlanta that's supposed to be upscale, and it's supposed to be, where, the upper crust lives. And so, but we're hearing about it having incidents there on a regular basis now. And the city of Atlanta is just having a lot of difficulty dealing with this because it is not the culture of Atlanta, yet it is happening. So the mayor is being challenged, the police department is being challenged to give the perception that the city of Atlanta and the suburbs like Buckhead are safe. So we want to make sure that that is happening. But again, this happened in the daytime. Right. So this was not a late night after party shooting. This was daytime. And so this is happening. This is as a society in general. As people are becoming, guns are easier to obtain. People are getting them, and they're not thinking before they use them. They're just, arguments that nobody wants to discuss or debate. They just want to, pull a gun out. And once a gun has been presented, then the level of confrontation is one that's life-threatening. So if the other person has a firearm, now you're going to literally have the shootout at the OK Corral.
Well, you brought up a good point, Dr. Collier. In fact, I do want to share an experience that occurred with me this weekend.
No, let's hear it, Dr. Jackson.
I talk about false power. And a lot of people get false power because they have a firearm. Mm-hmm. When you have a firearm, you've got a tool that can take people's lives or can maim or injure them. So it makes you feel a little more confident, okay? Sometimes to the point of stupidity and foolishness. Well, my mother and myself, we were driving out of town to go see, a relative who'd been ill. Well, I was using GPS and I missed the exit, exit, and I went to the next exit, turned, and then I was turning right. Well, as I was turning right, this motorcycle man on the motorcycle was kind of behind me. I can tell he was driving quite fast. Well, as he proceeded to pass me, he paused and gave me the biggest middle finger possible. So, of course, I didn't get upset, but I said, okay, we're just going down the street. But I thought about it. I was like, why are you giving me the middle finger? Well, as nature and karma would have it, we both were at the light, stoplight. So I kind of rolled my window down just to see why were you so, vehemently, nasty. And so the man, I told my mother, I said, the way this person was acting, they've got to be strapped. They've got to have a firearm. Well, as I pulled up to the light and looked at this individual, they had their firearm. Okay, but as he saw that it was me, then he turned and scowled at me. And I just looked at him back. I didn't flinch or nothing like that. And I told him, it's not worth it, bro. It's not worth it. So I basically didn't escalate anything, and he eventually went on about his business. But if he didn't have that false power, that firearm, and if I would have had one, me seeing him have one, that could have led us both into a situation which could easily lead into that 10 seconds of murderous rage, is what we all see people do.
That's what we all see people do. And I know personally, the first time that I was given a firearm, one of my patients gave me a really nice, in a red velvet lined case, a silver firearm with pearl handles. It was a beautiful firearm, and he gifted it to me. And so I didn't want to take it in the house. I kept it in my car trunk. But what I found, as you stated, Dr. Jackson, is that just knowing that I had it in the trunk, sometimes in confrontations that didn't matter, and in circumstances that I normally would not have given a second thought, my rage level was higher, and my I guess you could say my desire for confrontation was higher because I had false power. And so I gave it back to the patient. I said, look, I don't like the way that this makes me feel. It's not my personality, and so I think that we need to. I said, this is too nice for me to just set it aside. I said, somebody needs to use it that can appreciate it. I said, I cannot. So I gave it back to him, and he understood that, but I think he was still disappointed. But I told him, I said no. But so now, as I matured, now 30 years later, it was recommended that you should have a firearm to provide your personal protection. And so but you get firearm training, you make sure that you have you in a lockbox, so that kids don't have access to it. There are safety protocols that should be in place, but I still wish that it wasn't that circumstance. You didn't have to feel like you got to have a firearm for self-protection.
Well, what most people don't understand about with this false power, which means you feel more empowered because of the firearm, that's what we call false power. The gun is real.
The gun is real.
Okay. But the power you feel about it, and where you might go into some dubious and nefarious situations because you had that firearm. But people who had a firearm tend to get addicted to the firearm. They have to carry it all the time. And what happens, the firearm becomes a crutch. And a firearm is supposed to be a tool, Dr. Collier. Just a tool to use. All right. And people who carry that firearm with them all the time, and especially, let's just say folks who be doing other activities where they be pacing around the house like you see in the movies, and they looking out the window with their firearm and all that. Well, at some point in time, you have to put the gun down. All right. I don't know of many people where they have to go to the restroom and do number two. Well, if you do number two, you got to put the firearm down and pick up the toilet paper. And a lot of times when people are in them situations, some of those people are in situations because they've had death threats and the like. But at some point in time, you got to put the gun down. And some people might know that. They'll know when you go to the bathroom and when it's number two. And then they know that your time is due. But my whole point is, use a firearm as a tool and not a crutch. And therefore, if you have wisdom, then you don't have the foolhardiness. And a lot of times what happens is people get their egos broke or their feelings hurt, and they've got to, have that bravado, especially men, to prove a point when it's not worth it.
When it's not worth it. There was an incident in the city of Atlanta that I was reading an article in the newspaper about yesterday. That was because now in the state of Georgia, the government has passed the open carry law that you don't have to have a license, you don't have to have any training or documentation. If you want to carry a firearm, you can carry one with no penalty. And so this young man was carrying a firearm openly in a holster, and he was in a large retail facility. For whatever reason, he grabbed the gun and shot himself in the leg. Okay, when the bullet went through his leg, hit the ground, which was solid ground, tile, concrete, whatever, ricocheted and hit 3 other people. This was a magic bullet that only rivals the Kennedy shooting. Right. So 4 people total. The person that had the gun in his pocket that shot himself in the leg, and the bullet hit the ground, ricocheted, and hit 3 other people. Fortunately, none of the injuries were life-threatening, but still, I don't want a bullet wound in me anywhere. And secondly, the gentleman was charged with failure to secure his firearm or whatever. That was really, he wasn't even charged with a crime for shooting the other 3 people yet. I'm sure this is going to be a problem for him, though. But the problem is that why that circumstance even exists. This is a daytime situation. You just walking around, you in the store, and and your gun is not secure. It's a crutch. And so why he ended up feeling the need to touch it, grab it, not take it out of the holster, and end up shooting himself in the leg. That is just crazy. But again, that's happened. So that's where we are with that. So hearing those stories, and many of them like them, can cause a cortisol reaction. Your stress hormones will increase, making your pulse goes up, your heart rate goes up. A lot of people, particularly if they had a stressful day, your mind will block that out until you lie down in a dark, quiet room. When that happens, all of a sudden you become aware of your heartbeat. And particularly if it's not a smooth rhythm, then you're on standby for self-administered CPR because you don't know when your heart is going to stop. So that creates a stressor that can make it more difficult for you to sleep. So try to calm yourself down. A few minutes of meditation or prayer before you go to bed. A dark, quiet room that's cool temperature-wise. If you find that, as I have gotten a little older, I found that I don't like the weight of the comforter on my feet. So I fold the comforter back off so my feet are hanging free. I have little footies on so my feet don't get cold.
I can't stand them sheets tucked in.
I have to untuck them, lift them up, and I just literally fold them back so that my feet are free, and I get a much better night's sleep. And so, sometimes that's more difficult, particularly if I go to a hotel and they do, I don't know how deeply they tuck those sheets, but sometimes now they put multiple sheets on the bed with a thin blanket between them. I hate that because it's very difficult to cool off under those circumstances. But cool room, dark room, quiet yourself down before you go. Try to schedule a minimum of 7 hours of sleep at night so that you will wake up feeling rested, restored, and your body is ready for the next day. Okay, we're going to shift gears now. We're going to go to a dental topic. Dr. Jackson, regale us with your wisdom on dental health.
All right. Well, dental health is like medical health. There's so many items to consider. But let's go back to that toothache, because I think at some point in time in everybody's life, that's something that they have had, a toothache. It could be due to a abscess from the cavity process getting to the nerve, killing the nerve, and it becomes infected with bacteria from your mouth. And at the end of the tooth, you have infection. And what happens is when you have infection, we call that a hot tooth. Hot, real hot.
It is physically hot. It's inflamed. Inflammation causes the rhubarb, which is redness and turgor. It gets tense, and then the intensity, it literally feels warm to the touch.
Right, and another thing is very painful to the touch, either palpation or percussion. If you ever have a toothache and you go to the dentist, and the astute dentist, after they take the x-ray and evaluate your tooth, they're going to tap on it, all right? Well, first of all, they should tap on a normal tooth. and they'll say, okay, how does this feel? And it doesn't bother you. But when you get to that tooth,
that hot tooth,
that hard
tooth,
then you rise like dope. You jump out the chair. That's when you know that's the culprit and that's the problem. And then what to do with it is awful, the issue. And a lot of times when people first experience a toothache, they may have not, especially after this pandemic, and they haven't had regular dental care, or they don't have a regular dentist. And they may have, when you're on quarantine, you may have had all big bags of candy and you eat all the candy.
Yeah, you were Netflix and chilling and snacking and putting on your COVID-15 because you were eating all that fun stuff.
Right, and then all of a sudden, you have a cavity and you think it might be just a little defect or a small little place. And then all of a sudden you might eat a piece of soft bread, and then it will crack. And then all of a sudden, it wasn't sensitive to air, but all of a sudden it is. But then all of a sudden, like I said, at night, if you have a toothache at night and you didn't go to the dentist, you don't know which tooth it was, what do you do? Because that's a horrible situation to know that the rest of the world is asleep.
And you moaning and groaning with a toothache.
Yeah, moaning and groaning.
So that's a great question. Now, what do you do under those circumstances? Because you go to the emergency room. I've seen people with excruciating pain.
Don't go to the emergency room.
Because they don't do anything for you except tell you to go to the dentist the next day.
Right. That's $1,000 bill minimum. And even for the Tylenol 3, they give it to you, but they can't do anything there. They can't x-ray the tooth. Don't go to the emergency room for a toothache. Now, if you have a toothache because you have infection, and the infection is like down in your jaw, coming up toward your throat or Adam's apple, feeling like you're choking, yes, go to the emergency room immediately.
That
can
is
turn
a medical
into
emergency.
A life-threatening situation.
You get swelling around the glottis and epiglottis, and you literally closes off your airway and you can't breathe. And so that situation takes some time to develop.
Yes.
It's highly unusual for that to develop in like overnight. So you know what's going on with that. You need to get to the dentist and not wait. I cannot tell you the number of times people say, I got a dental abscess or my tooth is hurting. Can you give me a prescription for antibiotics? And I will give them a prescription for antibiotics, an anti-inflammatory as well to help the pain, but I always give them a referral, follow up with a dentist, usually Dr. Jackson. But I say, don't come back in 2 weeks. Because now you took a course of antibiotics, you relieved the pain, but the problem has not been fixed. It may no longer be an active inflamed abscess, but you still got dental disease and you got a cavity, and that tooth is only getting worse over time. And like I said, you'll get to a point where that nerve is ultimately killed and it's not hurting anymore. And you say, oh, this is good, it's better. No, it's not. That's the worst possible scenario now, because now you're not getting that feedback from pain. So you're chewing on it, you're chomping on it, you're having some major problems, and you end up possibly. I literally just had a patient. This happened last week, Dr. Jackson. Patient with a dental abscess, got some antibiotics, didn't go to the dentist, ultimately ended up having a stroke. From that, and the neck swelled up, as we stated, over time, just like it can, and the doctor thinks it closed off the carotid artery by putting pressure on it, and they had a stroke. Yes. Oh, it definitely, this has happened, and this person was in great shape, and this is how they found out. They went to the hospital, and they were being discharged, and in their discharge consultation, they were saying, we're going to get you a walker, and so that you'll be able to get around. And her sister was there, and her sister said, a walker? She doesn't need to walk. She walks 3 miles a day. She's extraordinarily physically fit. Right. She's walking 3 miles a day every day. So until then, and then noticed, sister looked at it and said, the sister's a trained clinician. She looked in the face, saw facial asymmetry, and said, oh my gosh, she's had a stroke. And she had. And so the discharge was terminated. She was readmitted to the hospital, CT scans, CAT scans, etc. But the etiology of all of that was dental disease, a dental abscess that was not addressed because, she got the antibiotics, felt better, didn't go to the dentist for follow-up. So this is a problem.
Well, and then too, let's address that issue. The patient knows they have an abscess and they get the antibiotics and they take them. A couple of things happen. Depending on, I'm sure if you've listened to Dr. Collier, you've heard the word compliant. which means follow instructions to the letter for the best results possible. But a lot of times patients will get the antibiotics. They'll take, it normally takes 2 to 3 days for antibiotics to work for a dental infection. Even though you may feel significantly better overnight, but you'll still feel some symptoms till the second or third day.
Mm-hmm.
But when the symptoms abate or get better, the patients usually stop taking the medicine. Now tell them what can happen when they stop taking their antibiotics midstream in the presence of an infection.
Oh, great point, Dr. Jackson, because every infection is a mixed population of infectious organisms, okay? In this situation, bacteria. So let's say 60 to 70% of that population is easy to kill. The antibody that you've chosen knocks out in the first 24 hours almost. So it decreases your burden of infection. Let's say 20% of it is harder to kill, but will respond to the antibiotic if you take it for the period of time that you should. And then you may have 5 or 10% of the bacteria that's remaining, difficult to kill, but if you hang in there and take the medication throughout the period of time that you should, will probably eradicate the infection. But what happens is you decrease the first 24 hours, 70% of your bacterial burden. So now you don't have a lot of inflammation. The next 4 or 5 days, you knock out the other 20%. So now, instead of 100% of bacteria, you only got 10%. This is not really causing you any problems right now. So you stop taking the medicine, which people do all of the time. So they didn't kill the bad bacteria, but now what they have done is isolate the bad bacteria. So what was a mixed infection of mild bacteria, moderate disease, and then really bad bacteria, now it's 100% of the bad bacteria.
Yeah, bad boy infection.
So the infection comes back now, and you have a super infection. And so now the antibiotic that you were taking before is no longer effective. So now you have to go on, strong antibiotics or triple antibiotic therapy, or it requires IV antibiotics in the hospital. So now you have taken a situation that was easy enough to treat and control and turns it into a major expense. And again, and possibly life-threatening. Let's not forget, infectious disease is the number 3 cause of death in the world, not just the United States of America, but in the world. People get infections and they die from them. And so it's something that starts off as simple as a tooth infection, ultimately ends up in your demise. And people just blink and wonder, because you can get infection in your sinuses. You can get infection, you're inhaling this, so now you end up with a pneumonia that's very difficult to treat, and pneumonia kills people every day. You have to understand the risk that you're putting yourself at by minimizing your treatment for dental disease. So when the person gets through, as you stated, Dr. Jackson, they don't go to the emergency room. What do? You don't want to do that. They were up all night with the toothache. Now, what's the next course of action?
Well, let's discuss how, because most toothaches that people have occur at night when they're lying down in that prone state. And what happens is that your blood pressure equalizes in your body when you're lying down. So when you're standing up, your pressure is greater where, Dr. Collier? At the top or the bottom of your body?
Well, that's a good question, Dr. Jackson.
Gravity
would be the bottom.
Right.
Yeah.
Right. So when you're laying down, it's equalized. So therefore, that's why if you have a toothache, it pounds at night. And then what happens, it makes you get up, it makes you move around, and that tends to upturn or lower the pain somewhat. But most of the time when people have a toothache, they're caught, they're not prepared. So what do you do when you have a toothache? What do you do? Well, the first thing you want to do is walk it off if you have to. Mm-hmm. All right. If it's not working, run. Okay, you can get on a treadmill, or you can just run in place. Okay, but run. What you're trying to do is trying to get the blood away from that area. Something that I think works extremely well is warm salt water. My best regimen that I tell patients, even for infection or even for halitosis, is to get them a plastic cup, fill it up with about 10 ounces of water, put a teaspoon, not a dash, but an actual teaspoon of salt, and stir it up, put it in the microwave for about 40 seconds, and rinse, hold it in for 2 to 5 seconds, and swish and spit. And what you'll find is that salt solution really destroys a lot of bacteria real quick. And usually when you have infection in your mouth, like Dr. Collier says, there is a form of a biosphere of bacteria and protozoa. Those are moving bacteria that move in your mouth.
Yeah, that is. If you can see that on a microscopic level, it is so frightening. I've seen Dr. Jackson make scientific presentations and give that slide, and everybody in the room just go, "Ooh!" It's just incredible when you do that. So a simple salt solution. That's a very good point. And so that was a teaspoon, not a tablespoon. 10 ounces of water, and warm it in the microwave. You don't have to be scalding hot. If it feels warm to you, that's warm enough. And so swish it around. That's going to give you, it has a topical anesthetic effect as well as a therapeutic effect to help kill bacteria. So now we've gotten you through the night.
Okay, well, I got to give something else, because this is what 90% of the people do that think they have an abscess or infection. They use peroxide.
Yes.
Okay, they use full strength peroxide.
Which is caustic and will burn the mucous membrane of your mouth.
Absolutely. Okay, then you got two problems. You got a toothache and you got a soft tissue problem. And I've seen the burns from peroxide can be pretty extensive, and they take just as long to heal as it would after you've had a tooth removed. So please don't use peroxide at all in terms of trying to rinse your mouth for an infection. Now, they do have small amounts of peroxide in some of our toothpaste or dentifrices. Small amounts. They know what to use, but leave that to the professionals. I want you to use warm salt water.
Warm salt water.
And a teaspoon of peroxide. You want to
a teaspoon of salt.
I mean, yeah, a teaspoon of salt. Now, yeah, I'm just checking to see if you study.
Okay, I'm studying now.
But rinse and spit, and because some people may have high blood pressure, you don't want to swallow because then you've got that salt.
And it also will make you very nauseated. If you've ever been in the ocean and you swallow ocean water, you know it's cathartic. It will make you vomit and make you very nauseated. So you don't want to swallow it. You want to swish it around and then spit it out. And you can do it over and over. You don't have to, try to hold it in your mouth for 10 minutes. You can just rinse, spit, and then do it again. Repeat. Rinse, spit,
about
repeat.
5 times.
Yeah,
about
you can
5
do that.
times.
And you've gotten the benefit.
Right. And then too, after you've done that, if you can find some Aleve or Tylenol Extra Strength, Tylenol PM, if you have that in your medicine cabinet, and in fact, I'm sure Dr. Collier has told everybody at some point in time, what does a family, or what do you have in your medicine cabinet for emergencies or whatever have you? But if you find something that you can take for pain, and you've gotten that pain to be manageable, whatever you do, don't lie flat back down on the bed. Keep your head elevated on 2 to 3 pillows. 2 to 3 pillows, okay? Because if you lay flat down, you're going to get back up and be the running man again.
It's going to be throbbing.
Running,
once again,
going nowhere.
As that pressure equalizes, now that every time your heart beats, it's sending that pulse pressure to that tooth nerve, and it's aggravating and irritating it. So you don't want to do that. Okay, so we've gotten through the night, Dr. Jackson. Now, what's the next course of action? What do you recommend?
Well, I recommend them to get up and find a dentist immediately. If you have one, call them. If their office hours are 8:30, 8 o'clock, call them at 8. Get in queue.
Right. Absolutely. Get in queue, and don't, this is not something you can wait 3 to 4 weeks for to be seen. But again, the emergency room is not the place to go for dental health. You need to be seen by a dental professional. You need to make sure that you have that type of relationship. The time to meet your dentist is not when you're in crisis. I tell people that all the time. The time to meet your doctor is not while you're having a heart attack or you need emergency surgery. You need to already have established a relationship. That person needs to know you. They need to know your physiology, needs to know about your overall health. And that way they are much more effective in helping you when you are in crisis than if you're just meeting for the first time and decisions have to be made rapidly and you have to try to figure out, what's going on with the patient, etc. And they sometimes aren't in a position to talk, or they're not unwilling to talk. All they worried about is this excruciating dental pain. And so you tell them to take an anti-inflammatory, but they're on blood thinners, but you never had that conversation. And so they're not supposed to take Motrin, Advil, or Aleve. They can take Tylenol. And so you would have said, take extra strength Tylenol, which will give you pain relief, but you never had the conversation.
Right.
Or you find out later they were on blood thinners, and you hope that that's not an issue. So those types of, again, that's not the time to meet your medical professional. So try to establish a routine care. You need a primary care medical provider, a primary care dental provider. I tell everybody, you need a lawyer, a banker, and a plumber, all them on your Rolodex, and people that you know, so that when your pipes burst, you know who to call. You don't want to call the 24-hour emergency pipeline, because that's how they get you. So if you go to, if you have that relationship with your healthcare provider, you'll find that you're going to have a much better outcome from that perspective. So anything else you want to tell us about the dental emergency, Dr. Jackson?
Well, there's another, well, we can make that a future broadcast, but in terms of trying to, like Dr. Collier says, once you make it to the next day, try to seek the services of a dentist immediately. If they're a good dentist, they're probably going to have a waiting list, but hopefully they always try to have 1 or 2 slots open to see urgent care. And if they're a real good dental office, they'll make room for you if you have what you call pain level 8, 9, and 10 pain. Why don't we go over the pain level?
Okay, let's do it.
Real quick.
Let's do it. So basically, you'll always be asked by a provider, what is your level of pain from 0 to 10? With 0 being I'm pain free, to 10 that is excruciating pain, debilitating pain. I can't
crying,
I'm
moaning, groaning.
And if it's 10 plus, that means everybody sometimes exaggerate. They'll say it's 20 on a scale of 10. But then we're talking, we're laughing, we're joking, so I know it's not 20 on a scale of 10. So I say realistically, give me a number that's consistent with your level of pain, so we'll know what you're doing and how you're feeling. So, you try to assess that. There's a pain scale. There's also, there are even pain evaluating tools for people who cannot express themselves verbally, or people that don't speak English. You can point literally to get to the level of pain and discomfort that they're in. And so most of the time, the level of pain is consistent with the degree of pathology, meaning the more that you're hurting, the more pain and discomfort that you're going to have. The more disease state you are, the more urgent it is, the more bad the abscess, the more significant the infection is. If it's just a minor pain, then it's usually a minor. Sometimes that's not indeed the case. Like I said, the worst end-stage dental disease may not hurt at all, but your jaw is the size of a softball, and you know something's not right. It's inflamed, it's tender to the touch, you got a fever, and you're in much more crisis than you are the 2 months before, when you just were having a toothache, when that nerve was just being aggravated or irritated. So when you're assessing a person's pain, they come to your office, what do you do?
Well, like you said, first of all, I'm used to those emoticons that tell you what a pain level 0 is and what a pain level 10 is. But when a person has a dental pain level 10, they're moving around, they're not smiling, they don't laugh. In fact, they can get rowdy and bowdy real quickly over a toothache. In fact, some people, when I've looked at some criminology cases, some people have committed crimes
because the tooth was hurting.
Because the tooth was hurting, but
change their personality.
Right. So when you have pain level 10, you can't lie. It's there.
It's there.
It's there.
It's there. So when you have that pain, that level of pain, again, get into the dentist's office. Let them do something acute. Now I have seen circumstances where a person, it was too inflamed, too infected. The dentist couldn't, quote, do anything with it. They wanted to put them on antibiotics for a few days first.
Excellent question.
Because they said, well, I went to the dentist. Why didn't he do something? He did do something.
Well, like when a person has pain level 10 or 8, 9, and 10, they want something done right then.
They want something done
immediately. And those people are not in a rational state. They don't understand the bioscience of infection, and therefore don't know that if the doctor tries to treat that patient with the tooth in that acidic environment, first of all, the anesthesia might not work. It may not work on that particular area of that tooth, because the infection is like a force field around it. It makes it imperceptible to anesthetics, which means the anesthetic can't get to that particular area to work. Now their whole jaw, their tongue, and everything else
will be numb.
They look like they're having a stroke.
But the hot spot
But that one tooth, they
it's
feel
not coming down when we were doing that.
So that's why we don't let well, an astute dentist won't try to pull a tooth in the presence of an infection like that, especially with pain level 8, 9, and 10. Plus, another thing, it makes you have a bad experience, and if you have a bad experience, it just reinforces what people already think about the perception of a dentist.
Absolutely, it's the dentist's fault that they can't give you relief, but the inflammation that's caused when you have an acute infection can overwhelm the basic physiology of anesthesia. You cannot numb those nerves until they're calmed down. So that's why you may get a few days of antibiotics and anti-inflammatories to calm it down. Then it can be adequately and appropriately treated when you have that issue. So that has been an amazing topic, Dr. Jackson, and one of many we're going to address on future podcasts. So we want to thank you for tuning in to the Paging Dr. MJ 911 podcast. Your health is important. Dr. Marlon B. Jackson of Auburn Dental Care, and he can be reached on all social media at Atlanta's Best DDS. Is that correct?
That's correct.
Atlanta's Best DDS. And you can reach me on all social media at Ask ASK Dr. MJ. Go to my YouTube channel, Ask Dr. MJ, and you can watch this video and share it with your friends. We want you to follow us on Facebook. We'll follow you back, we promise. And tune into this podcast regularly. We're going to be your medical ready reference. We're going to be where you get your medical health, your dental health, your social, your political, your financial health. We're going to have aspects and experts brought forth on this podcast that will elevate you so that you can be the best you that you can be, and you can sustain your health. Why, Dr. Jackson?
Well, first of all, before we tell them that, let's give them our acronym for health. HEALTH. Your health is a healing energy that, what, Dr. Collier? Come on. A healing energy that allows life to happen.
That allows life to happen. Healing energy that allows life to happen.
That's health.
HEALTH.
You can't see it.
You can't see it.
To measure it, but boy, when you're not healthy, you sure do know it.
Sure.
And
Your
so do a
health
lot of people.
is your wealth.
Wealth.
Your health is your wealth. Dr. Jackson has been saying that for 20 plus years, and he created that acronym. That's why I'm just so glad to have him as my medical partner and the medical A team come to you on this podcast. So tune in, Ask ASK Dr. MJ and
Dr. Marlon Jackson, keeping it real and making it plain, keeping you healthy, free of pain.
And your social media handle?
Atlanta's Best DDS.
Atlanta's Best DDS. And we're going to say it once again, we're going to say it together. Why? Because your health is important.